On LA County's deadliest day ever in this raging pandemic, a disturbing sight. National Guard troops unloading body after body from a truck in bags. The LA County morgue is so full now, COVID victims must be stored in a dozen refrigerated trailers. LA County reported 318 deaths today from COVID-19, an all-time record. And LA County reported a stunning 18,000 new cases amid a relentless post-holiday surge. Doctors say it didn't have to be this way.
So much of it has been preventable. The very high numbers I will report today are sadly no surprise. They didn't happen by accident. They are a direct result of the many people who were not following the necessary precautions over the winter holiday.
And local hospitals are at a crossroads doctors never imagined we'd see. Many LA County hospitals are bracing for the possibility they will start what they call crisis care, rationing beds, equipment, and therapies.
Then we're at crisis care, at the point at which we have to make decisions between person A and person B because we only have one of something.
In other words, hospitals would have to make difficult, if not impossible, decisions about who lives and who dies. The county just set up teams of triage officers who would decide who to help based on factors like who would survive the longest after treatment. It's happened before in hospitals in New York and Italy that were crushed by a massive surge of COVID patients. While several Southland hospitals say they aren't there yet, it could start soon. Imagine this scenario.
Patients are everywhere. We don't have a place to put patients. We don't have the things we need to take care of patients. We don't have any more people to help take care of patients. They have to be really bad for us to get to that point.
Methodist Hospital of Southern California in Arcadia already gathered a team of experts to prepare for that possibility. Their ICU is full, but they stressed they have not yet had to ration care.
When our hospitals are full, they're not just full of COVID patients. They're full of all of the other kinds of patients that we usually see. And this can affect them as well.
LA County is now warning the next 2 to 4 weeks will be the worst. A respected model from the University of Washington agrees. It predicts the current surge will grow worse each day, with daily infections and deaths climbing until a peak on January 27th.
Doctors and hospital officials I talked to said crisis care is not inevitable. We can still turn things around. They know you've heard this before, but wearing a mask and not gathering with people outside of your household can get the numbers down, which can in turn keep people out of the hospital. And that will help not just COVID patients, but anybody who might end up needing emergency care. Sara Donchey, KCAL 9 News.